Hi there, Dr. Ron Brown here from True Balance, and today we're going to be talking about testosterone injections and what I consider to be the proper technique for this injection for men. I have used testosterone replacement for at least 14 years, and in the last 6 years gone over to testosterone injections on a weekly basis, and I self-inject. Some of our clients are wondering, well, how do I do this? And I thought, let's put together a video showing you what I think best practice is, having done this for 8 years myself, which means I've given myself more than 400 of these injections. So first, let's look at the kind of products that we need in order to do this. We'll just move over here to the tray. Here I have a 1 cc syringe. It covers doses up to 1 cc per week. If you have to use, or if your dose is more than 1.0 cc's per week, then you can go up to the next size of syringe, which is a 3 cc syringe. I just find the 1 cc very easy to see the marks or gradations on the syringe. You're also going to need an 18 gauge needle. Please note, this is to draw up the testosterone. Do not inject yourself with an 18 gauge needle. You'll only do it once and you'll never make that mistake again. This is a 22 gauge needle, roughly 1 inch long, and that's what you're going to be giving the injection with. Always you have an alcohol swab and you have the testosterone. And here's the testosterone I'm going to do, and we're actually going to go through an injection here today so you see how to do that. So first of all, I'm going to open up my syringe, and I'm going to take my 18 gauge needle and attach it. We use the alcohol swab to clean the top of the testosterone, and we don't throw that away. We keep that because we're going to use it for cleaning the skin. I always do it like that. I know some people don't like that, but you know what? You got to be a little bit crazy and different some of the time. Always pull back and put the amount of air that you want to put into the syringe into the bottle. I then do that, inject the air, and now I'm going to fill my syringe up, and you can see it filling up with the testosterone. If you slant both things the way that I'm doing it, you get the least amount of air, and we just keep filling it up. Sometimes you've got a few air bubbles in there. It's easy to clear them and then continue the injection or drawing up the medicine. And there we have it. Now I don't have a full cc. Normally I would use a full cc, but for this particular injection, since I'm going to be demonstrating, I don't need it because I'm actually not due for my shot quite yet. So then you cap the needle and take that off. This gets thrown away. Now we're going to use the 22 needle. Okay, this is the one, and the advantage is here. Why don't we use this to start? We could save a needle, because even drawing up the testosterone will dull this needle. We don't want to dull the needle. We want it absolutely super sharp, so when it goes through our skin, it doesn't hurt. So then what we do is we just clear any air in there, and you can just see a little drop of testosterone come out there. Hi folks, we're back here again. Obviously now I'm disrobed and re-robed so I don't interfere with anybody's sensibilities other than the staff members that had to watch me do this. So what I'm going to do is I inject on the lateral thigh. That's this area here on the thigh. You can tense this muscle and feel that it's just right under the surface there. So we don't have to go very deep into it. I divide the leg in the midline, and I always want to be on the outside of the midline. So if the midline is there, I'm going to want to be in this area here, which is the safety area. So all that I do is I've cleaned my needle so that I've got no air left in there. I clear a spot where I'm going to put the needle in, and then I just simply dart it in like a dart. And that's it. Now ideally you should pull back and make sure that there's no blood coming back there. I actually don't do that. I just put it in and then I inject it. And what I'm doing is I'm stabilizing this in such a way that all the medicine is going slowly into the muscle there. You can see I didn't even stop talking. So this is basically a painless injection. You can see me giving myself my injection, no problem. The faster you put it in, the more the chance is that it'll just be uncomfortable a little bit. But generally speaking, it doesn't bother you very much. Trying to stabilize the needle and keeping track of it so you're not going deeper as you push the medicine is. Once I've reached the base of the needle, I just take that out and cover it up. So sometimes it'll bleed, so all that I do is I leave it for about 30 seconds to a minute, holding pressure here. You'll notice I'll keep talking while this is there. I'm sitting in a chair that's comfortable. My feet are on the ground, not dangling over the edge of the bed or anything else like that. And so I've lined everything up so that I have the optimum chances of an uncomplicated procedure. And always in these things you want uncomplicated. I've given you the markings for this area there. The other thing is most men will notice a little bit of discomfort a day after this injection in the area that they injected as they're walking and climbing stairs and doing other things. That's normal because the testosterone is being broken down and absorbed into your bloodstream. So there'll always be a little bit of tenderness. I always give my injection on the same day, and I try and not be very physically active for about an hour after the injection. I want everything to settle down. I don't want there to be bleeding from underneath the skin that then creates a lot of discomfort. I want everything to settle down. So now I've had pressure on there. I'm going to take that pressure off. We can see that there's no ongoing bleeding. And sometimes if I'm not certain, there's just a little spot there. I'll again just apply a little bit of pressure. Think about things I need to do. Typically I'll go to the office afterwards and work for a half an hour to an hour afterwards. That way I'm not wasting time, but I'm not going out and mowing the lawn or chopping wood. That's going to increase your chances of a deep bruise and therefore discomfort afterwards. In all this time, we've never had a case of infection or anything else. You can see this is simple and straightforward. I do this rather than using cream. I used cream for about 6 years and found that this is far simpler for me to do. It's simple, easy, and I hope this gives you an idea of what to do. Now, some men are not comfortable self-administering, and so they may have a partner that is willing to give them an intramuscular injection, which is what this is. This is an intramuscular injection. If that's the case, we're going to show you quickly how to do that. I recommend all intramuscular injections that are not self-administered be given in the buttock. I do not recommend shoulder injections. I know some patients have done that. I know there's Google videos for that. I don't think it's a good idea. IM injections in hospitals are always given into the buttock, and we're going to show you just a simple way to landmark this so that your partner or significant other can give you that injection.
As we just saw Dr. Brown inject himself, I'm a registered nurse and I'm part of True Balance Clinic, and I'm going to show you how to recap the needle and not how to put the needle head in your mouth. So to recap the needle, you balance your hands very gently and just insert like this, turn and twist. So it's very important that you don't do a flying cap like this, like Dr. Brown. You base your hands and then stick it in like that. The next one is to actually be able to take the needle off. So when we're doing the needles, we don't put the cap into our mouth. That's a Dr. Brown trick, but the nurses at True Balance don't do it that way. So when taking, again, you take it, you balance it in your hand, and you twist. So when I take the lid off, I balance it in my hand and I pull back like this so I can't poke myself. Again, putting the lid on like that. Thank you very much for watching our video, and I trust you'll be able to give great IM injections.
Hi folks, we're back here again, and this is part 2 of the testosterone injection video, and this is for clients that wish to have a partner or significant other inject them. So they're going to be getting an IM injection in the buttock. Now, first of all, we've got our setup. So we've got our 1 cc needle with the 18 gauge. We're going to do it the way the nurse showed you, even though it's not the way that I do it. And we've uncapped the needle. We're going to clean the top of the medication off. Remember, we draw back enough air to inject into the syringe so that we don't build up too much of a negative pressure in there. That's the reason for that. So put the air in, now draw the medicine out. And again, I always do it on an angle because I find that that minimizes the air bubbles. I then usually inject back a little bit to clear the air bubble there. And now I'm just injecting the medication. So in this case, we're going to be giving 1 cc of this medication. Clear that, and again, I will now show you the proper technique of capping this needle that the nurse demonstrated so capably. And we take the 18 gauge off, and again, like I explained before, move to the 22 gauge needle that is going to be, now sometimes these are a little bit tricky. You'll put them on and you actually have to stabilize it with your thumbnail when you pull it off, because this is not a luer lock syringe. If that happens, it's no big deal. And then all against a dark background, all that I do is I make sure that I'm not leaving any air left in that particular syringe. I'm just going to recap this while we're getting ready, because we have to go over the landmarking of the buttock. So if we can just move over here, here we have a patient lying down. Obviously there's the buttock. The easiest way to think of things is just the buttock goes right up to the crest up here, and you can feel that crest there. We just roughly make a quadrant. This is your safe area for doing an IM injection. There are no large blood vessels or nerves there. I'm obviously put a pair of gloves on because I wish this to be a sterile injection, and this is in fact an IM injection. So we've got our testosterone. We've cleared the air out. We're just going to clear in here. Okay, you're going to feel a little pinprick here. I want you just to wiggle your toes, little pinprick. And again, the injection is quick and up to the hub. This is a deep injection. I've pulled back to make sure, see me pulling back to make sure that there's no blood coming back. And then I just inject this at a gradual fashion. This is into the muscle. It's called an IM, or intramuscular injection, and relatively painless. So again, then we just pull this out, and you can see there, if you do it quick and easy, in this situation, there's not even any bleeding. So the person can then, again, I still tell them take it relatively easy, but we're basically blood-free. And that ends your tutorial on testosterone injections for men and women, on how to self-administer the injection or to have a partner do that. If you have any questions, please feel free to reach out to True Balance or to the compounding pharmacy that helped prescribe the medication for you. Have a great day. Thank you very much, Dr. Ron Brown.